Good afternoon, everybody. Thank you for joining us today. I'm Jenny Montgomery. We begin with an important and deliberate mission to spread awareness about cancer. The Georgia Cancer Center is all about research and treatment of the terrible disease, and at the same time, it reflects a commitment to outstanding patient care and community outreach. The team there believes that education is the first step in cancer prevention, and a lot of people in the community stand with the GCC through their support of Paceline. Just last month, Paceline announced a donation of more than $252,000 to the Georgia Cancer Center. The money comes from Paceline's fundraising efforts in 2024. Despite its annual Pace Day event being canceled by Helene, Paceline still says it was able to raise money thanks to its participants and local businesses.
The movement that we run year round, and we're proud to run, is really as a result of the community coming together in the fight against cancer. And we're just sort of in the middle of that, if you like, enabling that passion and that spirit of a community.
When we have these supports that we can give to our investigators so that they can come up with new ideas, generate some data, some pilot data, and then go out and get these bigger grants and expand that research, it is fantastic.
Since its founding in 2019, Paceline has raised more than $1.7 million for cancer research. And now the Georgia Cancer Center and Augusta University are bringing back the HPV Vax Bash for AU students to learn about the human papillomavirus and get the vaccine. Maryclaire Regan, who is with me right here, is the outreach coordinator at the Georgia Cancer Center, and Shelli Larkin is the director of student health services at Augusta University. And thank you both for being here with us today.
Thanks for having us.
We're really excited to help promote this. And now both of your teams are hosting the event. And it's a really great way for the students to come out and learn how to protect themselves against HPV.
That's right. We are so thrilled to have started this event in partnership with Student Health Services last year. This is the third iteration of the event on March 25th, and it just helps our students learn about HPV in a low-stakes setting where they can get their questions answered by our wonderful healthcare providers, both at Student Health Services and the Department of Public Health. And then if they are interested in getting the vaccine, they can check their status and get it completely free of charge, whether through their insurance or through DPH's federal program that provides vaccines free of charge for those without insurance.
And checking your status is important because these students today, it was available earlier, like when they were preteens. Is it like 11 or 12 when doctors start recommending it to parents?
It is. 11 to 12 is where it's at, but we're actually now 9 to 12 trying to get that.
Even younger. Okay.
Yes, absolutely. Trying to get that vaccine in them because of the efficacy of it.
And this is for students who have not had it. So this is what you're saying.
Correct.
They check their status, and if they have not been vaccinated, they can get it. They can get vaccinated right there, and it's free to them.
That's correct.
That's so important, so important. And, you know, I think for, maybe if you are talking about 9, 10, 11 years old, they might not really even be paying attention. It's a parent's decision.
True.
So this is a great way to educate them about what this vaccine can do and what it can help protect them from.
Right.
Absolutely.
And we believe information is power, so we want to empower our young people with this information so they can make informed decisions about their health. And if they can get the vaccine, it can literally prevent cancer.
And there are different kinds of HPV cancers, is that right?
That's
Absolutely.
correct.
It's linked to anal, oropharyngeal, and cervical cancer, just to name the top 3.
Really?
Absolutely.
Okay.
And we really are focused on making sure that all genders get vaccinated, females and males, because it is so transmittable, and we know it's linked to so many of those cancers.
And isn't it wonderful that we have the ability to have this vaccine to help prevent that?
Absolutely.
Yeah. And I guess in a college population, they really do need to know about that. Now, on the day, that Tuesday, March 25th, it's from 11 a.m. to 1 p.m. What all is happening at that event at the amphitheater?
Yeah, it's actually going to be a super fun event, and Dr. Larkin is actually hosting a larger event. It will be the Student Health and Wellness Fair, and HPV Vax Bash will be a smaller part within that. But students can come, they play HPV trivia to get a little information, then they can go to Student Health Services, get their status checked. And then from there, they move to Department of Public Health if they're interested in the vaccine or if they have more questions. And we have therapy dogs on hand in case they have any anxiety about talking about this health condition
Yeah.
or getting the vaccine.
Oh, very nice. Very nice.
And we have our nurses and healthcare providers on site as well to answer any questions and offer the education that is so needed for our students.
And it is available to all AU students.
Absolutely.
And I like it that you have those contingency plans with people to talk, people to educate, dogs to help ease anxiety.
Yes.
You've got your bases covered for this event.
It's really fun.
Try to be
Very
comprehensive.
good. Anything else that you want us to know about the misconceptions about HPV?
I think one of them is that it's just females get cervical cancer from HPV, and it's absolutely not. One of the highest populations is the oropharyngeal cancers in males over the age of 40. So it is all available all the way up to age 45. We want to start young, 9 through 12, but if you're not vaccinated, you can go all the way up in males and females up to the age of 45 now.
Okay, that is really important information. So if you missed out as a child and you're not yet 45, you can still get vaccinated against it.
It's a conversation with your healthcare provider to see if that fits within what you need for your life, but it is there and available for them.
And what do you say to some of the parents who feel like, well, I don't need to get that for my children because they're not going to have any kind of premarital sex?
It's not about that. It's about that intimate skin-to-skin contact. Again, there's HPV strains that are linked just to skin and the what they cause. So it's not just about intimate. It's about skin-to-skin. Over 80% of people will be exposed to it at some time in their life.
We're not talking about STDs here. It's not that.
Yeah, and if you have skin, you're at risk. That's what we're telling folks. I literally have a flow diagram and it says, do you have skin? No, yes. If yes, you are at risk for HPV. It's that simple.
It really breaks it down.
It really, it's that simple.
Well, Maryclaire and Shelli, thank you all so much for being here with us today. This is such great information. And I want to give you the information one more time about the HPV Vax Bash. The date is March 25th from 11 a.m. to 1 p.m. at the Bernard Amphitheater on the Somerville campus. HPV Vax Bash is a fun-filled event for Augusta University students. Everyone can receive the vaccine free of charge regardless of insurance status. We'll be right back.